Hi everybody, and welcome back to another episode of Why Was It Worth It? This one, we're gonna tackle the big three monsters, the scary ones, the big three things that hold everybody from doing surgery. Scars, pain, as well as anesthesia. There's not a single day that I don't see my patients that bring up at least one of these three things that they're worried about. And I would say most of the patients' fears about not undergoing surgery probably has to do with one of these three, either one or the combination of these three. So let's tackle them one by one. Let's talk about anesthesia. The thing that I hear from a lot of my patients all the time is, I want to do this operation, but I'm really deathly afraid of anesthesia. And my answer is namely two things. Most of what you know about anesthesia and it being scary and patients not making it is honestly old information from our parents' time, or maybe even our grandparents' time, where anesthesia was not a well-controlled discipline. Yes, back in the day, they used to give a little bit of ether or chloroform and hope for the best, but that's not really where we are today. Today, that is one of the most studied, researched, and one of the highest numbers of procedures performed worldwide. So any procedure that we do under general anesthesia requires us to have accreditation for our surgery center, which we've had now for over 20 years. It requires an anesthesiologist who's extremely capable. Mine happens to be someone I've worked with for 15 years, and she was trained as a neurosurgeon and a cardiac anesthesiologist, so she's superb. And having the devices that can track you on a regular basis with regards to a pulse oximeter, having a CO2 monitor. The anesthesiologist throughout the case is monitoring every single aspect of you. You're being better monitored than at any other time in your life. All right. And then my other thing about it is the reality of the probability of issues with anesthesia is if you got in your car and drove to my office, you took a bigger risk with your life than you undergoing general anesthesia. Those are the facts. That is the truth. So you take a bigger risk every time you get in a car of getting into a car accident and potentially dying than all the millions of patients who have general anesthesia every day when they have surgery around the world. Okay, that's the anesthesia part. Now let's talk about pain. Well, anytime you do surgery, you have to expect some kind of a discomfort, right? So I tell my patients, it's not like going for a run. Even going for a run, you're gonna get some soreness after, right? So it is a physical manifestation of change to your body. And of course, you're gonna respond to that and you are gonna feel something. But how you come at it from a mental standpoint is what's gonna differentiate you with regards to your recovery. Now, from our perspective, what are we doing? Well, at the time of the surgery, I do what's called preemptive anesthesia, which is very important. I actually numb the patient before the patient undergoes the very first incision. It's important to do that even before the patient is completely out under anesthesia because it completely calms the nervous system. After the surgery is done, when all the maneuvers have been done, I usually do what's called a long-term anesthetic block. Now, when it comes to the abdominoplasties, for example, we're numbing all the intercostal nerves. That's called an LTAP block. When it comes to the breast area, I'm numbing all the intercostals in the chest area on the inside and on the outside. So that completely numbs it. And of course, with the face, we actually start by putting numbing medicine in a solution called tumescent. And then afterwards, we're giving another long-term anesthetic to make sure that when you emerge from that surgery, you have very minimal pain. Last but not least is scars. And I want to make sure we sort of talk about scars in three different ways. One is pre-surgery. What do we do, what we learned before the surgery, what your surgeon can do during the time of the surgery, and then what essentially you're going to be doing after the surgery. Okay, so the pre-surgery is really the conversation that you have with your surgeon. It's important for you to let them know the story about if there's any incidents of bad scarring in the family. Usually keloid formers are part of that. They have a genetic capacity. The second part is how you healed, whether it was from a trauma, you had something that was just left alone versus a surgery that you had where the surgeon paid attention, because those two can make a big difference, right? Just because you healed one way with something that happened when you were a kid, it could be very different if a surgeon did, let's say, a C-section scar. And I want to see all of those. I want to see all those scars and learn about you and how you heal, okay? So that's before. Moving to the time of the surgery, which is the most important, which is why you pick your surgeon. Your surgeon is the one who's going to determine how the dissection is done and if it's done atraumatically and in the right planes, the right way with minimal trauma, you're likely going to have a very good recovery. If your surgeon is able to repair everything in multiple levels, now they're removing tension from the scar, which is probably one of the most indicators for your great outcome. Okay, so it's important, like when I do surgery, depending on where I'm at, I'm doing it at the minimum of 3 layers, sometimes 4 layers, and sometimes even 5 layers of closure, because I want to minimize that tension that's on the incision, because I know that's going to give you the best outcome. Okay, so that's important. And then after the surgery, there's different modalities. Initially, the dressing that I use on your incision is important. I want to make sure that I'm minimizing, again, tension on that scar. I'm able to see how things are healing. I'm minimizing any fluid, so I'm putting a non-adherent sort of a gauze that doesn't stick, but at the same time is protecting you against the outside world. Think of it as almost like a shield, a second skin. And then afterwards, we want to switch you to likely a silicone gel. That silicone gel or silicone cream has been shown scientifically to have the best outcome with regards to managing and modulating your scar. Now, there are scenarios that I may see and I may think that, you know what, in your case, I may need to do other modalities to help decrease the wound tension or the scar. And so I will use other devices for that. But we're going to have that conversation when the time comes for that. Or I may decide that the scar is too red, and I may advise to you that you should need to have a BBL, which is a laser or light therapy for redness and decreases the level of the redness. Or I may decide that there's too much deposition of collagen, in which case I may want to modulate that with the use of steroids and or a chemical agent that is a modulator. And last but not least, one of my other favorites is to use exosomes or stem cells to be able to modulate the healing, because they're sending signals to the scar to sort of remodify itself. By the way, sometimes I may do a combination of things, right? Depending on what your needs are, it's really important to have a surgeon that feels very confident and versatile with all these modalities to be able to get you to your final goal.